Bladder cancer is one of the conditions. First of all, it's not a common condition. It's certainly not in the top 5 or even 8 of cancers that patients can get, but it's obviously very important that we do pick it up in the patients who do develop bladder cancer. Some cancers don't have any symptoms until very late, and that's one of the diagnostic challenges that we have. Fortunately for bladder cancer, it is one of the cancers that often has some symptoms fairly early on, and the commonest one is blood in the urine, what we call macroscopic haematuria, which just means that you actually know the blood is there as the patient because you can see it in the urine when you're passing it. With that, you may have a symptom of sort of discomfort passing urine as well, and sometimes you'll get discomfort but no obvious sort of macroscopic blood as well. If we test the urine, we might see some blood in there microscopically, but it may not be sort of visible to the naked eye. There are some other symptoms that can be associated with bladder cancer, including things like back pain or pelvic pain, but they're very general, non-specific symptoms. So for example, back pain is common in the community. Most of us will have one or more episodes of back pain during our life, and we know that less than 1% of those cases will actually be associated with any sort of cancer, let alone bladder cancer. So the main thing we would be saying to patients is to be aware of any change in your urine symptoms, any discomfort, any heaviness in the pelvis, but in particular if you have any bleeding. Now, it doesn't mean bleeding is going to mean bladder cancer. In fact, in many cases, it's not the likely diagnosis. If you're a young woman, sexually active young woman, you've got blood in your urine and discomfort, much more likely to be a urinary tract infection, for instance. But as people get older, particularly in their sort of 50s and 60s and older, if you've got new blood in your urine, in other words, if you haven't had it there before, we'd be much more concerned that there might be a sinister cause like bladder cancer, and we certainly would want to investigate it until we find out what the cause was. There can be other causes as well. Changes to urine flow tend to occur particularly in men as they get older, and the vast majority of those are associated with changes in prostate size, often benign changes rather than malignant changes or cancer changes in the prostate. Women can get changes in urinary flow as well, and they can get that for a number of reasons. Probably the commonest one in women is if they have weakness of the pelvic floor, a muscle that sort of supports the bladder, and the commonest cause of that is pressure on the pelvic floor from conditions such as childbirth and then normal aging and weakening of the tissues. Occasionally, you can get structural problems, such as tumour causing a blockage of the outlet of the bladder, and so patients may present with an acute difficulty in passing urine, in other words, sudden onset. Again, I think it's a bit of a no-brainer that if you suddenly can't pass urine, you need to talk to somebody pretty quickly about it. But if you do notice that you've had any sort of change over time in your urine flow, you should get it investigated. Again, it's likely that it won't be a bladder cancer diagnosis, particularly if you don't have other symptoms like hematuria, but it means that something's changing, and we need to know what's causing that change and if there's something we can do about it. But my advice would be, if you've got blood in your urine, you really probably should see somebody in the next 24 or 48 hours. If there's a particular delay in accessing facilities, particularly if you're very remote, then you should at least speak to somebody who can advise you as to what to do next.